So this question is something, uh, you know, it's about the research that you published. So after you publish the fecal transplant, article, many of the Ayush people, especially Ayurveda people, they also started claiming that fecal transplantation is also there in their textbook because they've been, using various other kind of, animal feces, and also I think they are also using I don't know much, but I think in the textbook is there the use of human feces as a medicine. So the question is fecal transplantation in modern medicine is same as Ayurvedic fecal transplantation?
So I think when we say fecal transplant, to simplify, it is something known as healthy donor stool transplant, where in certain disease conditions, where we know that from an evidence point of view that a change in the microbes, be it bacteria, fungus, or viruses within the human body, mostly in the intestine and large and small intestine, when these microorganisms or microbes change, the germs change to a bad profile. We call it as a pathogenic profile, which is a disease causing profile. Uh, Repopulating that with healthy or good bacteria or good microbes actually improves the clinical condition and the disease processes, or reduces the disease process, reduces complications of the disease in certain conditions. For example, if you look at liver disease per se, uh, there is a condition known as hepatic encephalopathy, where high amounts of ammonia is generated in the body because of change in the gut bacteria and all that, and that affects the brain. So if you do a stool transplant in this group of patients, give them good bacteria through healthy donor stool transplant, where we give suspensions of stool suspensions made from healthy people, and then you put it inside the small intestine of these patients with brain failure, and the good bacteria actually reduces the episodes of brain failure. So this is well proven. Same case with in a condition called C. difficile infection, where a bacteria attacks the large intestine, causes ulcers, and can cause recurrent ulcers and recurrent disease, and patients can actually die, especially critically ill patients. In them also, a healthy donor stool transplant actually improves outcomes. So this is healthy donor stool transplant, which has been researched in various other disease conditions. Now coming to the fecal transplant aspect in Ayurveda. So in Ayurveda, it is not fecal transplant. I would call it as coprophagia, and it is a fetish. So basically, the sages and all who wrote this probably 2000 years ago, I think they had some fetish for animal feces, whereby they started putting animal feces. You name any animal, either the semen, urine, or feces is part of treatment in various forms in Ayurveda. And what happens is that when these treatments in the text, what they have actually mentioned is that this has been used to modify vata, pitta, kapha, and all that stuff, which is again delusional principles in Ayurveda. And it has nothing to do with the scientific or evidentiary aspect of what we actually know from what we do stool transplants right now. So when I say that I'm going to do stool transplant for a patient with alcohol related hepatitis, I know exactly what I'm doing for that patient and why I'm doing it. But in Ayurveda, I don't think they actually knew anything about any of these aspects of scientific aspects of changing the gut microbiome. But they love to extrapolate newer things to ancient beliefs and all that. And I feel that fecal transplants in Ayurveda, you should not call it fecal transplants. It is coprophagia, and it's a fetish. It's unnatural sexual offense, and it's not even it's interspecies coprophagia and fetish, which is even worse, I think. So please don't believe that Ayurveda has anything to do with fecal transplant. It has absolutely nothing to do with it.